Hello, everyone, and welcome back to the channel where we make medicine make sense. If you're ready to learn smarter, not harder, let's start crafting. Let's begin. So, ankylosing spondylitis. It's a chronic condition, and remember that's very important for your PACES exam. So, let's see how the patient would present. Usually, a patient with ankylosing spondylitis is young, male or female, usually classically it's seen in males. They will come in with chronic backache. Remember to ask the Socrates history when you're taking a pain history. Stiffness, which we worse in the morning, and the patient would say that improves with exercise. And pain usually occurs at night, which improves on getting up. If we talk about other associated features that are very important to ask when you're taking a history of ankylosing spondylitis, so remember to ask if there's any redness, grittiness, or pain/problems with vision in the eye. So that could signify anterior uveitis. Ask the patient if he or she has cough, which could signify apical fibrosis. Ask about the fact that if he or she is facing any racing of heartbeat or has any presyncopal symptoms or shortness of breath, that could signify an AV nodal block or an aortic regurgitation. Ask about if there's any problem with the bowel or bladder or any numbness in the thigh, legs, or in the genital area, that could signify a cauda equina. Any pain at the back of the heel or at the ankle, again, that would signify an Achilles tendonitis. Any peripheral joint pain, that would uh, signify that patient has arthritis peripheral. Amyloidosis is a multi-system involvement. Other important questions that need to be addressed are weight loss and if there are any night sweats, which could signify a neoplastic history. Ask about fever, which can help you tell that there's an infective pathology, like for example, discitis, osteomyelitis. Ask about TB contacts, ask about dysuria, you see, which is usually seen in reactive arthritis. Check for any nail changes or rashes. That could signify psoriatic arthritis. Any trauma to the back, very important to ask. And any history of weightlifting, family history of IBD, diarrhea, or blood in the stool. So, moving on to the next part, which is clinical examination. So, remember, the most important thing is to expose the patient. It doesn't matter if it's a male or female, always ask to expose. Maybe the examiner says that you don't need to, but always uh, say that to expose. So you examine the back, check for any spinal deformities or any localized swelling or tenderness. Check the lumbar spine movement. So you would be checking lateral and forward flexion. Are they reduced? Perform a modified Showbiz test. There's already a short video how to perform a modified Showbiz test. Occipit to wall test, very important to perform. Um, and the other significant things to examine are the eyes for any redness, chest for any reduced expansion or apical crepes, heart if there's any collapsing pulse or murmur, any tenderness over Achilles tendon or in lower limb for power and sensation. So, what tests are important to do in case of ankylosing spondylitis? So, we'll start with the blood test first. Perform a full blood count to check for anemia, inflammatory markers, and a genetic test called HLA-B27. Get an X-ray of the pelvis and spine. What you'd be looking for is for sarcoileitis, squaring of lumbar vertebrae, or syndesmophytes, which are a late feature. If you want to check early bone marrow edema, an MRI spine is the way to go. Usually in early disease, MRI is preferable. For other associated features, you can get an echocardiogram for an aortic regurg, ECG for AV nodal block. You can get a chest X-ray to look for apical fibrosis and perform a spirometry for restrictive pattern of the disease. Now, in terms of the management, it is divided into general, medical, and complication management. General management includes physiotherapy and occupational therapy. Ask the patient to do exercises, for example, swimming, which is quite helpful in these patients. In terms of medical management, NSAIDs, they are the first line medications. If there's peripheral disease, then the DMARDs like methotrexate or sulfasalazine can be started, and if above all fail, an anti-TNF agent like infliximab or etanercept can be used. In terms of management of complications, you can give steroids for anterior uveitis and offer valve replacement for aortic regurgitation. Now, coming towards another important part that is tested on PACES exam is the differential diagnosis. So, the differential diagnosis would be trauma to the back, a strain to lumbosacral spine, disc herniation, degeneration of the spine and osteoarthritis, infection like osteomyelitis, discitis, a TB, metastasis, or inflammatory bowel disease. That's all, folks. Thank you for watching.